Melasma, also known as hormonal pigmentation, is a very big part of our skin renewal practice. And many young women come into the clinic and they have pigmentation.
At Skin Renewal, we combine doctor-led care, cutting-edge technology, and a holistic approach to deliver personalized solutions that truly transform your skin. Just what you need right now.
So our doctors have been trained to see exactly what kind of pigmentation this is, whether it's melasma, which is, hormones are very responsible, and that normally occurs before the age of 30 or just after 30. And then we get sun damage, which occurs after the age of 40, and then we get post-inflammatory hyperpigmentation, which usually comes post-trauma, post a skin condition like eczema, scratch, acne. So it's very important to distinguish which kind of pigmentation we have. And melasma is one of our more difficult pigmentation to treat because there are many underlying causes of melasma. And very often, the genes load the gun, so there's a genetic predisposition, and then your lifestyle pulls the trigger. So this also depends on what kind of hormones you're on, whether you're on any artificial hormones like the oral contraceptive pill, pregnancy, in vitro fertilization, the patch, the Mirena. So any contraception that has hormones, and then very often you go onto hormone replacement therapy. So on the cells, on the melasma cells, the melanocytes, there's a receptor for hormones. And if you add fuel to the fire, if you add hormones to this mix, then those cells are triggered to make pigmentation. And then another big part of melasma, as we all know, is solar radiation. And most of the sun damage occurs before the age of 20. And then obviously starts showing at the age of 26 to 30 when you start seeing these hormonal patches come out. And then inflammation, usually due to our lifestyle choices, because once again we have to go back to the pillars of health. And if you address these pillars of health, then you're also going to address your melasma, and you're also going to address your health and improve your health. So once again, sleep and insulin are very important because lack of sleep and high insulin levels cause inflammation, which fuels pigmentation and fuels any chronic disease. Then we get gut problems eating inflammatory foods. So we must make sure that we keep the main inflammatory foods out of our diet, such as gluten, grains, oils, omega-3-6 ratio, because the omega-6 oils like sunflower, canola, fried foods are very inflammatory on the gut. And then you leak inflammation into the system, and then in the skin it triggers the melanocytes. And then, estrogen and liver detoxification is also very important. And then on my journey, I've, really researched melasma and chronic illness to see where it's all coming from. And very often it's mast cell activation syndrome. And the scientists have gone down a long path trying to see what actually, how the inflammation triggers the melasma in the skin. And that is due to mast cells, which are everywhere in the body, are triggered. And then they release histamine and tryptase, which one knows, is very responsible for melasma. So there are many treatments and causes of melasma. And the next video is going to be on what triggers melasma.